In Indonesia, the protection of basic health needs can be obtained by mutual cooperation through JKN-KIS program. This program is intended for all Indonesian citizens, including foreigners, who have been working for a minimum of 6 months in Indonesia and have paid their contributions. Why do you have to become one of the JKN-KIS participants? By becoming JKN-KIS participant, you and your family will be protected from the risks of being sick, especially a sickness that can cost a fortune. If you stay healthy, you can always help people who are sick. As a citizen, you and your family are obedient to follow the obligations of Law Number 40 of 2004. JKN-KIS participants includes 1. PBI health insurance for the impoverished. 2. Residents that have been registered by the regional government. 3. Those who are not part of PBI health insurance consist of A. Wage recipient workers. For example, workers who receive a salary every month, including B. Workers who are not wage recipients, that is, everyone who works for themselves or handle their own risks. C. Not workers who are able to pay their premium. A newborn baby from a mother who has become a JKN-KIS participant must also be registered and pay their premium to BPJS Kesehatan within a maximum of 28 days from the birthday. How much does the premium of JKN-KIS participant for each segment cost? The premium of PBI health insurance and residents that have been registered by the regional government cost 23,000 rupiah for one person per month with level 3 health facilities. PPU participants' premium costs 5% of per month salary, which provides PPU's premium for workers, aside from the state administrators, are 5% of the salary, where the 4% is paid by the employer and 1% paid by workers with an income limit of 8 million rupiah. B. The premium of state administrators' PPU is 5% of the salary, where the 3% of the premium is paid by the employer and 2% paid by the worker. PPU's premium is calculated based on the lowest limit of per month salary. State administrators, the village heads, and village officials is an exception because their salary has reached the minimum wage of their district, or city, or province. Regarding to the health facilities level for PPU, Level 1 and Level 2 will be adjusted based on groups and salary. JKN-KIS Premium gives assurance to workers, husbands or wives, and 3 children. Participants can include other family members, such as the 4th child and the rest of other children, fathers, mothers, and the in-laws. If the husband and wife are both workers, then both of them must be registered by the employer. For PBPU and BP, it is enough to pay the premium for themselves and their family according to the health facilities level they have chosen. For state official pensioners, civil servants, soldiers, members of the police, widows or widowers, or orphans from pensioners, the premium will only cost 5% from their pension fund and family allowance, where the 3% will be paid by the government and 2% will be paid by the pensioners. The Indonesian participants who live abroad for 6 consecutive months can stop their participation temporarily and get no benefits. After their return to Indonesia, the participants must report back to BPJS Kesehatan and pay their premium 1 month after their returning time and will also get their benefit back. This provision is an exception for PPU participants who still get their salaries in Indonesia. Premium are paid at the latest every 10th of every month through the following channels. For the JKN-KIS participants and employers who do not pay for the premium regularly and on time, participants will be suspended from the first day of the following month. Participation status will be active again if JKN-KIS participant A. Pay the rest of the overdue fee with a maximum of 24 months and B. Pay premium from the current month. If within 45 days the participants are back in an active status, the JKN-KIS participants that has received advanced hospitalization services must pay a 2.5% fine of the cost of INA CBG based on the diagnosis and the initial procedure for the each month's overdue from BPJS Kesehatan. To be more practical, JKN-KIS participants can take advantage of the auto-debit service offered by a number of BPJS Kesehatan partner banks. Where can the JKN-KIS participants do their registration? For wage recipients, registration can be done through For non-wage recipients and non-workers, registration can be done through What kind of benefits can the JKN-KIS participants get? JKN-KIS participants are entitled to obtain the following benefits. First-level health facilities include advanced level for health services include land or water ambulance services in an emergency situations. The benefits of promotive and preventive services include health services that are not guaranteed include JKN-KIS participants can improve their care facilities higher than their rights, including executive outpatient care by following additional health insurance or paying the difference between the costs guaranteed by BPJS Kesehatan and the cost to be paid due to the increased services. To be able to take advantage of the JKN-KIS program in health facilities, participants can follow the following procedure. 1. Go to the first-level health facilities or registered FKTP, such as health center, the individual practice doctors, BPJS Kesehatan clinic partners. 2. If the medical indications shows that you must refer to a hospital, you can go straight to a hospital that's cooperated with BPJS Kesehatan. 3. If in an emergency, you can go directly to the hospital emergency unit closest to your location. JKN-KIS participants who are outside the registered FKTP area can access the first-level outpatient services in other FKTP with a maximum of 3 visits in 1 month of FKTP. If JKN-KIS participants need an advanced level of health services, then it must be referred to FKRTL. Services at FKRTL are conducted in a maximum of 3 months. Let's register yourself and your family immediately. Don't forget to pay your premium on every 10th of every month. By becoming a JKN-KIS participant, you are also spreading kindness to the others. BPJS Kesehatan. With mutual cooperation, everyone is safe and healthy.